Thanks, Acting Premier. It is absolutely true that the changes that we're making are a reflection of the point that we've gotten to, again, through the very hard work of the Victorian community. We will be at 28 days without local transmission of coronavirus in Victoria come Friday, so it's entirely appropriate that we make these changes. There are always some baseline settings that are there to manage risk, and the recommendations that we make around wearing masks, around hygiene, around getting tested, they are recommendations that really will persist for some time. We need people to be aware that coronavirus can reach into our community again until we've got extremely high vaccination coverage. There is a sense, of course, we should all be optimistic about the rollout of vaccines, but we've got 1% of our eligible population covered at the moment. There's a long way to play out until we get high vaccination coverage, and so we really need to be aware and alive to the fact that bringing virus into the community will have the same potential to spread unless we're aware of those behaviours that we need to maintain, especially around testing, especially around excluding ourselves if we're unwell. And the recommendations around masks, again, the mandating of masks is really only in those few settings that have been mentioned, but the recommendations still apply. If you're in indoor settings, if you're in very close proximity to individuals, you really should consider wearing a mask. That will protect you against coronavirus. We're also going into a flu season, which is not a nothing illness either, and we want to protect ourselves from a whole bunch of respiratory viruses so that we don't even have to think about getting a coronavirus test. You'll be protected from a whole bunch of viruses, wearing masks, keeping your distance, washing your hands, coughing into your elbow, and excluding yourself from workplaces and school if unwell. So they're important things to bear in mind, but absolutely we're at a good point, and the 28-day mark will be another celebration for me, and I hope for all Victorians as we move to eased restrictions.
Jury, thanks, Brett.
Certainly we'd use the QR codes to help in contact tracing purposes, and so we absolutely encourage everyone to use QR codes where they see them presenting. But we use all tools available to us, so if that's EFTPOS, loyalty cards, we've used Myki cards, we use CCTV, so all of the tools that might be available to assist in contact tracing are utilised. But QR codes are a really critical one. They allow for that automatic upload for contact tracing purposes and give those kind of exact times and locations and of course the contact details. Look, certainly the rollout of QR codes, the fact that we've got to a long period of no community transmission, and in fact we're strengthening the quarantine program by getting our CQV workers vaccinated and other port of entry workers vaccinated. That's kind of a ring of steel of its own for quarantine. It doesn't mean that quarantine workers couldn't get infected. They could, but it does give them protection, and as we roll out the vaccine further, that will be, more insurance against anything coming through ports of entry or quarantine. That's certainly part of the increased testing. Part of it's that Victorians are just great at stepping up to get tested when they've got compatible symptoms, but part of it is we're going into, the winter cold and flu season, so some of it is respiratory syncytial virus, so RSV. There are many other viruses that kids and therefore adults in families are getting. They should get tested. We can never be sure that it's not COVID until you take that test. Look, that's not for me. I know the Premier can speak to that.
Thanks, Son.
What do you think about the prospect of setting up a kind of advertising or awareness campaign specifically about AstraZeneca, or would there be downsides to kind of hand selecting one and making it all?
I think there are constraints in terms of the TGA Act and the promotion of particular types of vaccine. But again, I would back the Minister in saying if the TGA has looked at a vaccine and it's gone through the very stringent regulatory processes and is being rolled out in Australia, then I would have confidence to receive it and to offer it to patients. We will always maintain vigilance in terms of any signals. We've got a surveillance system that looks at any adverse events, that reports them immediately, that collates and analyses them, so that if there are any concerning signals, we'll look into it, we'll inform clinicians what to look out for or how to manage, and we'll feed that up to the TGA for their consideration should anything happen. The reality is AstraZeneca vaccine has been given to tens of millions of people. It's been given to hundreds of thousands of people in clinical trials. And with regard to overall risk of clotting or bleeding, there are no signals that suggest that it's more likely to cause it. In fact, the European review suggested that people who'd received the vaccine were less likely to have bleeding or clotting disorders. There are reports of a very rare clotting disorder that is still being watched, and again, that's part of our robust surveillance system, that we will dig into any data in relation to that to see if any signals emerge in Australia.
Sorry, can you just describe that?
So there is a clotting disorder called CVST that was also picked up in Europe. It's not necessarily being caused by the vaccine, but it's something that they're watching very closely. It's extremely rare, and therefore it's very hard to say if it's associated with the vaccine, but cases have been reported. That was part of the concern of some European countries that suspended the AstraZeneca vaccine rollout for a time. Many of those are going back as they've seen the data that suggests that clotting and bleeding disorders are not at greater risk for those who've been vaccinated. But again, it's something that surveillance systems, safety systems need to keep an eye on ongoing.
How rare is rare?
A few per million cases. Again, whether you're in Europe with its tens, hundreds of thousands of cases per day, where the risk equation is clearly in favour of being vaccinated, or in Australia, where we know that getting vaccinated will protect us from the future risk whenever virus comes back or whenever we're opening our borders. That risk equation is very simple in my mind. We just need to be vaccinated. It's our pathway out of this, and it's the only way that we'll have the genuine protection that we need to protect others, but for the most vulnerable individuals to be protected from dying, from being hospitalised, from being in ICU.
How damaging is it when countries press pause on a specific vaccine, and how much do you think that filters to here, even though we haven't pressed pause?
Oh, I think it clearly filters through here. I know that GPs are getting phone calls. I know that there's lots of inquiries about vaccines because people read about this. So you do press pause whenever you need to, and you do it in a precautionary way. But I think some European countries have done it really against the European Medicines Agency and against their own regulatory authorities that have, provided evidence that it's pretty clear that there aren't safety signals associated with the vaccines. It can take some time for people to regain the confidence, or they'll say, I'm just going to wait a little while until I see how this plays out. I would say, especially if you're a vulnerable individual and you can get a book in now. As it's rolling out to GPs, that's a perfect time to get in the queue and to make sure that you can get vaccinated, protect yourself, protect your family.
Back to the
In your expert opinion, is it still too unsafe to Victoria's hotel quarantine?
I haven't got an opinion on the hotel quarantine system. I think the acting premier has spoken to that in terms of the process for agreeing it.
Just back to QR codes and you said before that you're confident that this new system is going to be the best in the country. We've heard before about the hotel quarantine, the system being the gold standard because you're shut down. In terms of the QR code system, why is it the best in the country when it's not just one system that's centralised, particularly when Service Victoria infrastructure has faced problems itself in coping with the voucher system and that sort of thing?
Yeah, what I said, Simon, it's a better approach in my view. So you've got the Service Victoria QR code, but you've also got many businesses right across the state that have got a private QR code that has other things attached to it. Their menu, an ordering system. We don't want to disrupt that. So I think the best way to go is having it very clear to businesses and organisations, anywhere that's required to have a QR set up, you must either have the Services Victoria QR code, or you've got your own QR code that connects through to the government API. That is, so we can very effectively follow that data immediately. So that's in my view a better approach than having one QR system that is subject to a crash.
Premier, why are all the QR code systems not electronic? Why are people still going to businesses and being asked to fill out the details that drugs can take?
So QR codes by definition are electronic and digital. There are occasions, you need a smartphone to do a QR code. So there are occasions where the physical recording of attendance visiting a cafe or a restaurant is done by pen and paper. But QR codes, I think this approach is the better way to go. And businesses will have that 28-day period to ensure that if they stick with their own QR code, it talks to the government API and that data can be immediately accessed.
My apologies, I was referring to the contact tracing system. Is it totally safe to have people still submitting their details with pen and paper?
Martin, do you want to take this one?
So not every Australian citizen has a smartphone. Not every facility is set up for that arrangement. Increasingly, they are. Right around Victoria, we're seeing the Victorian government's QR code system really take off, and I want to thank all those businesses, all those venues who have taken that important step. But there are many ways to address this issue. Older Victorians, venues that for all sorts of reasons don't have the infrastructure in support, even after this amount of time. We are encouraging those venues and those businesses to establish this arrangement. But we recognise that in some circumstances it may not be possible. But there are other circumstances where the public health advice is that is in fact mandatory. So commercial passenger vehicles and other arrangements like that. So this is a very much public health risk-based approach that we have confidence in, and we will make yet another contribution to the toolbox of the public health team's response to get us out of this pandemic.
I know we don't know active cases and you're not planning to bring in international flights before Friday. Is all this subject to obviously that not changing in the next couple of days?
Well, everything is always subject to the epidemiological conditions changing, but we have sufficient confidence in the efforts that Victorians have put in and that our public health team have put in to make these foreshadowed announcements now to take effect of 6 p.m. on Friday, to give us that next step of confidence that things are stable, that the recovery, be it a public health recovery, an economic recovery, a social and cultural recovery, is underway, and the Victorians' efforts are necessarily being rewarded.
Can I just ask Professor a couple of things about the amazing crowds?
Sure.
You just reflect on the football we saw over the weekend. You're happy with the 50,000, obviously, but is there anything going to be done to make sure 75,000 get in and out okay?
There'll be continued monitoring of those crowds, of the conditions that have been applied to those venues. So, ensuring that the hard zones are complied with, ensuring that the separation of facilities with those zones are complied with, and that the crowd are doing the right thing. I'm still confident that we can go to 75,000. I've placed another condition that it goes through a simulation exercise for contact tracing purposes. We've had desktop exercises with those venues and with the AFL to try and run through some of that, but I think a fully simulated test of a potential case in a zone would be very useful in understanding how the QR codes would feed in, how we do the contact tracing. So we'll continue to monitor, and none of this is a free pass. You've got to get it right in order to have that maintained as a condition.
So will that be done before Thursday night, that simulation?
No, that's over the next month, but you know, it's an exercise that's going to be useful for everyone involved, I think.
Are we likely to get up to 100% capacity at our sporting matches at the Anzac Day game against Fiji?
I think for very large venues, getting to 100% is pretty tricky. You've got to maintain those hard zones, and so you do need that space to be able to have the infrastructure to separate people. But we'll continue to review how things are going at 75%.
Can I invite you to reflect the fact that it's about a year to the day since we were told to stay home if you can?
Our longest year ever. You know, we've had very tough times in Victoria. There's no question. Nonetheless, most of my family are in the UK. When I speak to them, you know, my heart sinks. They are still in a lockdown. They've gone through rolling lockdowns that really add up to 200, 250 days now, and they've got lockdowns ahead of them. There are countries now in Europe, despite the vaccination rolling out, that are going to have a third wave or a fourth wave. So this has been a hard-fought victory. You know, my pride in the Victorian community, because it was no easy task to have almost 7 million people do the right thing. Not everyone all of the time, but to do enough to get to a point where not only was it a gift to the whole of the Victorian community, it's been a gift to the rest of Australia. I went up to Canberra with HPPC last week. I'm not sure Victorians recognise how grateful other jurisdictions are for what we went through in order to protect the whole of Australia, because that's the reality. You know, we've suffered through it, no question, and I recognise all of that hardship. But what a fantastic place to be in, to have some of these announcements today, and to really hopefully look forward to months and months ahead with a vaccine rolling out and continued, you know, low to no community transmission for months to come, with the freedoms that we all love and enjoy. Look, it's mostly for contact tracing purposes. So it'll be, you know, you've got someone who's positive and they're in seat, whatever, K120. What does that mean in terms of who is their close contacts? Who are the other casual contacts within those subzones? Who do we need to track across the hard zone? When they went to the toilet, is that on CCTV? Who else might they have come in contact with? So all of the measures that we would want to use for contact tracing purposes, so that we can chase up those close contacts and inform everyone else who might be at risk. Oh, look, no, we'll just go through, as is the case for many simulations, you just come up with a mock scenario. It doesn't have to be a real person, but we'll run through the procedures so that we know that the way that the QR codes talk to our contact tracing system and how we would activate that as a result would work.
These restrictions, what role, if any, did the vaccine rollout play? Because these are the loosest restrictions we've had since the second wave. What role, if any, did the vaccine rollout play?
Look, not really, other than the strengthened assurance around quarantine when you've got virtually all of your quarantine workforce vaccinated. They will be protected from getting symptomatic illness, from getting disease, great for them, but there's also some protection on them getting infected in the first place and therefore potentially going out in the community or passing it on to family members. So there is an additional protection in quarantine that does give me some more assurance around these settings, but primarily it's really being at zero transmission, having all of our robust systems in place, contact tracing, wastewater surveillance, and the ongoing testing that Victorians are doing really better than anyone.
On the other side, sorry, just one more on that. On the other side of the ledger, is there not awareness that the weather's getting colder, as you said before, people are spending more time indoors? Is there a risk that now with this, if there is a case, pop off more than usual?
There is a risk. There's always a risk, but through the winter season especially, we do want to emphasise to people that the transmissibility, the risk of passing on to many people, super spreading events, increases as people crowd indoors, spend more time in close proximity to others in an indoor space. So yes, keep that awareness of symptomatic illness, do the testing that needs to be done, make sure you're checking in with those QR codes wherever you go.